my Republican colleagues have reached the conclusion that this is not a perfect bill. Well, they're right. And while my problems with this bill are very different than theirs, I do hope that in the weeks and months to come after we pass this reconciliation package that we will improve it. But I would ask my Republican colleagues to tell me something. When they controlled the White House and they controlled the Senate and they controlled the House, when President Bush was our president, during that period, 7 million more Americans lost their health insurance and health care costs soared. Where were they then in talking about health care? Did they have one substantive idea during that period about how we were going to lower the cost of health care for Americans and provide health insurance for all of our people? Mr. President, I do hope that after we pass reconciliation, we are going to improve this bill. And in that regard, I want to thank Senator Reid, Majority Leader Reid, who has promised us, Senator Merkley, myself, and others, that we will have the chance to vote on a public option provision. I think millions of Americans understand that public option is a choice that people should have, the right to go outside of the private insurance companies for their health insurance, and that public option will provide competitive pressure on the insurance industry to control soaring health care costs. So I very much appreciate Senator Reid telling us that we are going to have a vote on that issue within a couple of months. Mr. President, this bill is a strong step forward. It is no small thing that we are providing health insurance to 32 million more Americans. It's no small thing that we are moving to eliminate pre-existing conditions as a grounds for rejecting someone for health care. It is no small thing that we're going to begin to fill that donut hole so that seniors will be able to get the prescription drugs they need in an affordable way. Those are, among other achievements, quite significant. But having said that, after the passage of this legislation, we still have got to deal with the reality that we will continue to spend far more per capita on health care than any other major country. Just a few days ago, we had the ambassador from Denmark visiting Vermont. In that country, they provide quality care to all of their people, and they do it spending about 50% of what we do, because they have eliminated private insurance companies and all of the administrative and profiteering costs associated with private insurance companies. And I hope that we will one day allow at least states the option to move forward with a single-payer Medicare for All program, which I think ultimately is the way we're going to go as a nation if we're going to solve the need for comprehensive, universal, and cost-effective health care for all of our people. But, Mr. President, I do want to say a word on one aspect, one provision of this bill, which I think is enormously important. And I'm very, very excited that it is included in this bill. And again, I want to thank Senator Reid for his help in making sure that it remained in and is amply funded. And that is that in this legislation, we are going to take a giant step forward in providing primary health care to the people of this country through a major expansion of community health centers and the National Health Service Corps. This legislation provides enough funding so that we are going to create over the next 5 years 8,000 new health center sites, more than doubling the number that now exists. We are going to increase access for primary health care, dental care, mental health counseling, and low-cost prescription drugs to an additional 20 million Americans in every state, in every region of this country. That is a huge step forward in providing basic health care to millions of Americans who today cannot access that care. And while we do that, we are also going to significantly expand the number of doctors, the number of nurse practitioners and dentists that we desperately need in order to provide primary health care to our people. This legislation triples, over a 5-year period, triples the amount of money going into the National Health Service Corps, a program which provides debt forgiveness and scholarships for those doctors and dentists who will be serving in underserved areas throughout this country. We are going to provide an additional 17,000 new primary health care doctors, dentists, nurse practitioners, and mental health professionals through this program. And what this means, Mr. President, is that if somebody has no health insurance, if somebody has Medicaid, if somebody has Medicare, if somebody has private health insurance, that individual is going to be able to walk into a community health center and get the high-quality care they need. And the incredible thing, Mr. President, and this is really quite remarkable, is that by doing this, we're going to actually save taxpayers money, because we're going to keep people out of the emergency room, which is the most expensive form of primary health care. We're going to prevent people from becoming sicker than they should and ending up in the hospital at great expense. Mr. President, this legislation is going to be very significant in providing the primary health care that we need as a nation, and I'm very appreciative